I'm Matthew Banks, and today I'm going to talk about the case study of Margaret and treating anxiety disorder with cognitive behavior therapy. So, Margaret is a 32-year-old woman who has recently been referred to counseling due to her having generalized anxiety. This diagnosis explains her symptoms of feeling anxious, nervous, and panicky for the past year. This has led to her having difficulty in shopping. Margaret has also experienced an increased heart beat to the point she thinks that she will pass out and spontaneous bursting into tears. This has caused her to flee and get out of the shop. Hence, it is likely that her generalized anxiety has worsened to the point where she feels she doesn't want to go out shopping anymore because of a fear of having another panic attack. Even though she is self-aware of her feelings and symptoms, she has had a hard time going out. She shows symptoms of breathlessness, nausea, and chest pain that cause her to hold tight onto the shopping cart and, worst case scenario, leave the store. Margaret has also read a self-help guide on the internet that can help her cope with these attacks. Having to go to the shop triggers Margaret to feel anxious. Only when she goes out, she panics and usually has to leave the store unless she can cope with it. Margaret has recently lost her job about a year ago, around at the time when she had the first panic attack, and was very stressed out of that time, not knowing what to do with her life. Due to her major life stress, it is likely that this event triggered her panic attack. Talking more with her, we can learn that she was abused by her parents, emotionally and physically as a child for many years, and finally she left the house when she was around 20 years old. When she left, not knowing what to do, she attended community college and paying her own tuition fee and graduating at the late age of 26. After that, she got a nice job working as an accountant at a local business, but due to a major downfall, the business had to let employees go, and Margaret was one of them. This was the first time after leaving her abusive home that she had the feeling of not knowing what to do, and that triggered the panic attack. Women are twice as likely to have some form of anxiety disorder than men, and biologically show more stress activity. Putting these factors into consideration, it is not surprising that Margaret has developed the anxiety disorder. After that, she finally found another job, but she still fears that she might have another panic attack. Her symptoms of heavy breathing, nausea, pain, dizziness, and feeling choking implies that she has panic disorder. Her concern and reoccurrence of panic attacks over the span of the year show that she is aware that another episode might occur. After experiencing a great amount of intense apprehension and terror, that she has become worried about going out to the shops. Her fear of shame or embarrassment and the feeling that she may not get help has a panic attack, and of having a panic attack is a symptom of agoraphobia. A panic disorder has similar symptoms to individuals who have agoraphobia. Panic attacks are frightening to people that fear losing oneself in front of people and can be embarrassing. The reoccurrence of pattern of her panic attacks in the shopping center can be linked to her agoraphobia and some form of behavioral conditioning. Her experience of panic attack in that location causes her to fear that it may happen again and further causes an attack. Simply put, her agoraphobia situation, which is shopping, provokes her to have an anxiety, to fear or have anxiety. The goal of CBT is to change the thoughts and therefore change the behaviors that cause the condition. The best treatment for Margaret would be to change her thought patterns, giving her different things she can do and get her to log how she feels by the next session is effective. There are ways to help her treatment, and one of the biggest ones would be self-guided treatment. One way is to get her to record for a week, noting her thoughts about certain situations where negative, explaining the frequency and duration intensity of it. This will help her to understand why she feels that way in that situation, help her be more aware of her emotions. Clients with panic disorder and agoraphobia usually do some form of combined treatment such as exposure therapy or systematic desensitization. This is when the person is exposed to the object, situation, or context without any danger to overcome and cope with it. In this context, getting her to go out to the supermarket where she had a last panic attack each day, little by little, would be effective. The key here is that she would slowly and gently expose herself to that place where she fears and diminish that fear over time. Another treatment would be getting Margaret to focus on her breathing and get her to positively talk to herself whenever she feels anxious or uneasy. This would be her focusing on learning coping skills, relaxation skills, and helping her maintain her calmness. Breathing steadily will help her control her fast heartbeat, and when she's anxious and has to calm down. Positive talk can aid her in changing her distorted thoughts into more healthy ones, helping her regain control of herself, having some company or social support can help too. The main reason why panic attacks can happen in an agoraphobic context is because that person is embarrassed of having an attack and not having help. If she were to have someone beside her who was familiar, she would be able to cope with it, maybe. Reading the self-help guide recommended by a therapist will be helpful too. Another treatment that could do is take antidepressants. At the start of the session, the healthcare provider could prescribe a group of antidepressants called selective serotonin reuptake inhibitors, or SSRIs, which is a medication prescribed to treat panic disorder and agoraphobia. The provider could give a certain amount when the treatment begins and decrease that dosage over time as the treatment proceeds. In Margaret's case, it would be a 5-session period. Overall, this should help her reduce the number of episodes she has and help her leave her safety zone without having to suffer with any severe anxiety. Regarding prognosis, Margaret has excellent potential and is expected to meet the result of the therapy due to her strong will to tackle the problem, positivity, awareness of a problem, and overall willingness to try different treatment methods. She's expected to progress, being able to reduce her occurrence of panic attacks and agoraphobia of the shopping center in the time of the 5 sessions and then the review session. This was it, and thank you.